Please welcome Christopher Molaro, Army veteran and founder and CEO of NeuroFlow, a digital health platform that helps healthcare providers integrate behavioral health into overall patient care.
Well, hi, welcome.
Thanks
It's great to see you. This conversation's been really interesting so far. I'm learning a lot, but
Absolutely.
You are going to bring us a very unique perspective and I would say new to maybe understated ways of addressing some of the, in particular, mental health challenges that veterans are facing now. Just give us the quick thumbnail, the elevator pitch on what exactly you're doing with NeuroFlow.
Sure. We're bringing technology, data analytics to support the care providers in the mix. So we're not providing the care. We partner with the therapists, the primary care providers, and really we're solving two problems. One, tons of people go unidentified of needing mental health support, just underdiagnosed and not understanding the risks associated with that. So we're using data across a bunch of different spectrums to identify mental health issues and input that into the clinical workflows. Once those issues are identified and care is being delivered, we use workflow tools and data to make sure quality care is being delivered and that the veteran or a patient is improving over time. And if not, we could hold those providers, those networks accountable for providing quality care.
So tell me how you're doing this, though. You're bringing technology to bear in a way that's never been brought before, mm-hmm. right? To identify those who may be in crisis or at least need some mental health care.
That's right. So there's these things called evidence-based assessments that are a few decades old, but they would always be given on paper and pen. Anybody that's visited a doctor recently, remember they ask a question about how many drinks you have, or have you been sleeping, or have you had feelings of hurting yourself?
And I'm sure everybody answers those very truthfully.
Exactly.
Yeah.
So we look at a bunch of different data sources, including digitizing those so they are done at home. And when people do it at home, they answer more honestly than handing it back to a nurse.
Is that right? I guess that stands to reason, yeah.
We've done over 7 million assessments on veterans in the last 15 to 18 months. And input that back in the electronic health record. What we've done, though, is identified suicide risk so that providers can be preemptive of getting ahead of those veterans' issues.
And how do you do that?
Well, sometimes it's just asking the question directly. The 9th question on the PHQ-9 assessment asks the question, and you'd be surprised with how many people endorse on that. But then we're using, AI is being used in very interesting ways. A lot of people think AI just means chatbots. AI does not mean chatbots. Chatbots is one utilization of AI. We're using AI to look at a bunch of disparate data sources, health claims data, EHR data, even wearable data to track activity level. Mm-hmm. All those different data pieces put together have clues for if somebody is at risk of depression, anxiety, and the severity of that risk sometimes.
So you go to mental health providers, therapists, doctors, physicians, and you offer them this technology, basically. Is that?
Yeah, that's right.
That's right.
Yeah, we partner with them. They do that. We, just started with the VA a few years ago, but commercially we provide this.
Mm-hmm. And give me the statistics again, and what is the increase in diagnoses and people that have been reached out to that would not have ordinarily been reached out to?
Well, we published a study with Prudential Insurance, so for people that are on disability. They identified 20% more people that, they have millions of people, so 20% of people that previously didn't have a mental health diagnosis needed mental health support, got them back to work faster. The VA actually has been doing measurement-based care. So if you think about, if you go to an oncologist, they're not going to ask you, how do you feel with your cancer? They're going to actually measure blood levels, tumor sizes, and so forth. That objectivity doesn't exist in mental health today, and we're starting to trend that way with technology.
I see. You served in the Army?
Yes, sir.
You led a platoon in Iraq. Mm-hmm. Can you tell me how that experience impacted your desire, your motivation to get into this business? And can you share a moment during your service that influences your work today?
Absolutely. I mean, my story starts, I was 22 years old. I was a brand new butter bar second lieutenant. And I was given a platoon, 38 soldiers that we deployed to Iraq. And, God bless them because they helped me succeed and kept me straight in terms of successful 287 combat missions in 12 months. Thank God we brought everyone home alive. And then back at our home base, there's several soldiers that struggled, including myself, with sleep issues, right, with increased anxiety. One soldier was brave enough to raise his hand and say, I'm drinking too much, I'm depressed. So he was referred to a therapist that was on base. Obviously, cost was free. And 3 months goes by, and we got a call that he completed suicide. And aside from losing him and the loss of life, the tragedy of the situation was we did a whole investigation afterwards. What happened? Was there negligence? He never once went to the therapy appointment that he was referred to. He never once went to the pharmacy to get the medication he was prescribed, and nobody, his leadership, his care, ever followed up to track how is he doing, is he improving? And all of those things were data points for if he's not getting the medication, he's not going to the therapy, obviously you're not going to get better. And that candidly was a leadership failure and a system failure that didn't need to exist. And so that's where technology, I don't think, is going to replace providers. But if you think about using technology appropriately, could have bridged those gaps to make sure he didn't fall through those gaps. I didn't have this aha moment back then. It was something I just struggled with. And it was years later, I transitioned out of active service into the reserves and went to Wharton Business School and was in a class called the Business of Healthcare and was learning about, wait, this isn't just a military veteran issue. Like, everybody struggles with mental health. It impacts Medicaid, Medicare, your sisters, your brothers, rural, urban, and nobody really was addressing it. And I thought, this is where technology can help be an extension of care rather than replace that care.
So it's not a magic wand. This is a way to identify and reach out to people who may not ordinarily reach out themselves. Or the example you gave was, we were earlier talking about the stigma of mental health and going to therapy, especially acute among people in the military.
Right.
And ensuring that if someone is to see a therapist, that they're actually going to see
That's right.
the therapist.
That's right.
Yeah.
I mean, it's not about adding more people. For the longest time, last decade, we've been talking about access and adding, we need more therapists or more psychiatrists. I think that's part of it, but you're just never going to have enough therapists and psychiatrists to meet the demand. The supply-demand inequity is too great. So the question is, how do we utilize the existing resources we have more efficiently and effectively? And that's where accountability, data, and using those resources precisely, I think, will help in a big way.
Is there a debate between sort of scalable tech versus providing more human resources and therapists? I mean, are there trade-offs? Can technology meaningfully reduce suicide risk, or is it mostly a support tool?
Well, we at NeuroFlow, we say high tech, high touch. So we don't want to replace the humans, but we want the humans involved to be able to operate at the top of their licensure. Depression is not a binary scale. It's not you have it or don't have it. And so if you just have mild seasonal depression, you don't need to go see a psychiatrist necessarily, but the higher risk person that needs to go to that. But if you send everybody to a psychiatrist, you create a bottleneck. That's where you get these 30 to 60-day wait times. And I think on the surface, you say, well, let's just add more psychiatrists to meet that demand. But what we say is, let's use that existing psychiatrist more efficiently, getting the people to the front of the line that need the psychiatrist and giving a different level of support to the other people.
So it's a question of working smarter, not harder in a way.
Exactly.
Yeah.
Well said.
Yeah. I'm giving people ideas left and right here. Congress people, CEOs. So the achievements that you're talking about, they sort of underscore the potency of effectively implementing evidence-based practices, right?
That's right.
Could you talk a little bit more about, how do people find you? How do veterans find you, people in need of help?
So we are the business model is a B2B business model or business-to-business business model. So we're not direct to consumer.
I see, right.
So someone's not just looking for NeuroFlow's tools and downloading them and accessing them by themselves. We are a software tool utilized by the healthcare professionals.
And how do they find you?
So work with them. We've been working with the VA for almost 8 years now, where they needed technology support to implement the evidence-based practices and needed to do that at scale and be integrated into their electronic health records, and we won that RFP. we work with health systems and payers around the country. About, almost 20 million people are analyzed on our platform every day. A small subset of those are VA.
What keeps you optimistic about the future of veterans' health in the United States?
We're talking about it. I mean, this conversation just is like, you can't fix it unless you measure it and unless you are starting to have the dialogue. And there's a tremendous amount of, I think, resources going behind it. People are acknowledging it more. Post-World War II and Vietnam, PTSD wasn't talked about. It wasn't a thing. Now, at least we're putting the resources behind it, and I think that's the first step in addressing it.
And what advice would you give to others, veterans, who want to found a company, want to get started, especially in the tech end of things, to get into veterans healthcare?
Well, I don't have a business background other than
well, you went to Wharton,
but before that, I didn't have a business background, and I certainly don't have a healthcare background other than being a patient perspective.
Yeah.
But I think surrounding yourself with great people and looking at what the underlying problem is, and then focusing on that problem is what got us started. And the VA was not our first customer. The VA would be like, "Are you kidding me? We're not going to work with this company that's not secure." All this stuff. So I
would imagine that the challenges with regard to being hired as an outside contractor at a place like the VA are enormous for a startup.
Oh, it was enormous, but it wasn't insurmountable. And I think if you're focused on the mission and you get to the right people and you can learn and so forth, we got in there, and now we're integrated into the EHR. I mean, we have such phenomenal engineers and data scientists on our team. The VA calls us for advice in terms of how to integrate into their own EHR. And it's just truly, as a veteran, I'm also a patient at the VA, so it's kind of cool. I get the text messages from our tech. Our tech is all white labeled, so if you didn't know it was our tech, it just looks like the VA. But I know it's our tech, so I'm like, oh, well, this button
that must be
right.
uniquely gratifying.
I'm like a secret shopper in the VA, I get to go in and give feedback in terms of how it's working. Yeah.
All right, well, great. I appreciate you coming around today. Do you have any closing thoughts that you'd like to share about this issue on the eve of, as we approach Veterans Day?
Yeah, well, first of all, it's a great honor to be here, so thank you for the opportunity. I'd say, number one, if you're a veteran or if you know a veteran or if anybody in your life is struggling with mental health, there are a ton of resources out there. And it doesn't matter, again, it's a spectrum. So there's nothing to be ashamed about. There are, from everything from suicide prevention to your seasonal depression when the days are shorter, ask for help. There are resources out there. And in terms of innovating, let's push the boundaries. The VA is doing some phenomenal work. And if we could continue to partner with them in those public-private arenas, I think we could change healthcare and we like to say, it's not just mental health over here and physical health over here. One affects the other. If you think about the patient that has diabetes and they also have untreated depression, that untreated depression, they're eating less healthy, you're less active, you're not taking your medication, it's making your diabetes worse. And then your diabetes gets worse, so you are more depressed. And you get into this negative cycle. And so if we could just change the conversation to being health, not mental versus physical health, I think we could change the world.
Okay. On that note, thank you very much. Good luck to you.
Thank you so much.
All right.